Hey, thanks for the question, and I'm really excited to answer it. So for those of you that don't know, Parkinson's, and I have been a healthcare administrator for over 15 years now. And I understand very, very well how the healthcare system works. So I'm going to give you some really, really good advice. You need to, number one, get a really good primary care physician. I don't care if it's an MD, an MP, a PA, get yourself a good primary care physician that's going to go to bat for you, that's going to go to bat for you with the specialists, that's going to go to bat for you with the insurance companies. Whatever you need, that person is the foundation that the system is built on, right? Once you have a primary care physician, they are required to coordinate all your care. And by coordinate your care, I mean track your labs, track your specialist referrals, and follow up on whatever your issues are. So when you go into your primary care physician and you say, I have this, I have that, I have this, then that creates what's called a care plan. And once things are in your care plan, they have to follow up with it. I'm not saying they do all this stuff. I'm saying they're required to do this stuff. And so once they become responsible in that way, once it becomes documented, they have to own it. And it's our job as the patient to make sure that we're that check and balance. We might not always have the same priorities. It's up to us as patients to set the priorities. So we have to work with them to balance, what's the problem that's the most important to us and to them, and address them in tandem, right? But the most important thing to remember is communication in healthcare is completely broken on every side. When you get a lab ordered, you can't know for sure that the lab got that order. When you get it done, you can't be sure that your doctor got the results back. You have to coordinate all that. It's unfortunate, but it's true. I carry my records, I carry my meds. I always request my own results from everything as soon as I get it. Because honestly, I like to read it myself. Even sometimes the way they interpret it is interesting to me. So don't be afraid to request it. It's your right. You have rights. They're defined by law, statute, and accreditatory body. And those rights are set in stone. Next time you go to your doctor or you go to a hospital, ask to see the patient's rights and responsibilities. They're usually on the wall. And know that you have avenues. If you're not happy with your care, you have avenues to have those things addressed. Most people, unfortunately, feel very powerless in the healthcare system. They think that the doctors and the hospitals control everything. And while that's true functionally, it's not true statutorily. And that's what I do for a living, is make sure that those laws are being complied with. And I always looked at it from the other side, like, protecting the organization, but now I see it from the other side, which is protecting myself and my own health. And so it's just really important that you know your rights. You have rights with your insurance company as well. I'm sure there's so many people out there that don't know appeals processes and programs that are available for, let's say, help with your medication costs. There's so many different resources out there people just don't know about. And that's super sad to me, because it should be, easier. It's something you have to do your homework on, but there is support out there for people if they have a good provider that's going to let them know about it. Unfortunately, in healthcare, everybody's short-staffed, everybody's overburdened. It's gotten super worse since the pandemic, and every structure that was kind of functioning has crumbled even more. And so it's really up to us to advocate for ourselves, push for ourselves. My kids tell me I'm a Karen, but you have to Karen your way through it sometimes. I mean, I take that as a compliment, because I will be Karening myself through the healthcare system, because I will file a complaint, I will ask to talk to the manager, I will, demand more, because that is supposed to be the standard. We've somehow settled in this like land of mediocrity that everybody's just like maneuvering through. And I'm here to say that if you accept less, you will get lesser. And that's just the way the system works. So, hope this helps.